Well, while social distancing has been hard for everyone, it's been especially challenging for our seniors. Dr. Jason Black is a geriatrician at Gilchrist. He's here to tell us more. Thank you so much for being with us.
Thank you.
So tell us a little bit about our seniors and how they've been affected by social distancing.
Well, our older adults have definitely been affected, as we all have. Many of them have been asked to stay in their homes. Some of them may live alone. And the isolation has been a challenge, certainly.
So what is the current status for our seniors? Are we now in a stage where people can begin visiting their parents and grandparents and loved ones again? And what precautions should they be taking if that's the case?
Well, if your loved one lives in their own home, then I think the answer is yes. Under those circumstances, you can judge your own risk and make the necessary precautions for a visit. If your loved one lives in an assisted living or a nursing facility, then that situation may be different.
Okay. And then also it's summertime, so I'm wondering about outside family gatherings. Is that okay? What should we be doing in those situations?
Well, currently, our recommendations are for gathering 10 or less. And I think under those circumstances, most people can find the space to social distance outside in a safe manner.
Okay, so just making sure we're social distancing, still wearing masks, correct? Probably the best bet.
Yeah. Be prepared to be a bit of a social distance police person, because you may have to gently remind people that 6 feet is 6 feet, and try to keep their space.
I think you're absolutely right about that, because a lot of times we ourselves are practicing social distancing. We're wearing the mask, but the next person might not be. So you're right. We have to call that attention so everyone is participating in that. And what advice do you have for those who have been putting off medical appointments? Because I know that was a big issue. And what do you say to them, and how can they ensure their safety when they're making these appointments?
Well, now is a good time to call that provider and ask their office what is currently the provider's plan for reopening the office or catching up on procedures. Your provider may be doing elective procedures now and have a protocol, for example, testing a few days before the procedure to see how to get back into the office.
Okay. And where can people go for more information on Gilchrist, making sure that our seniors are protected, especially as we navigate sort of out of this quarantine period?
Well, Gilchrist partners with GBMC, and GBMC has a nice website at gbmc.org, and that's a nice resource for everyone.
All right. Dr. Jason Black, thank you so much for being here. This is at the top of all of our minds, so I appreciate your input. And we'll be right back with more Midday Maryland right after this. Stay tuned.